Well, yes, our view arises from what the President indicated when he announced the ban on the 28th of December, that this was intended to allow for the health system to have maximum capacity to handle the then sharp rise in cases. And we have seen over the past this 14 days or so, the number of new infections is going down significantly compared to the time. And also the active cases have dropped significantly, with provinces that are about 50% decline in number of active cases. And the good thing also is the recovery rate that we seem to be witnessing. And that's really good news for the country. We need to contain this situation. I think what is most encouraging is what we have seen in the 4 provinces that probably contribute the most in terms of the caseload. The decrease in hospitalization in KwaZulu-Natal, Gauteng, Eastern Cape and Western Cape, with a decrease of between 60 to 69% in hospital occupancy. So that's encouraging. I think it's about time then we consider the economic effect of the current ban and give an opportunity for people to spend their life.
They also believe that there is a glaring need to actually limit further losses of jobs and revenue for the sector. Can you quantify, first of all, that loss of revenue and how many jobs actually have been lost as well?
Yeah, if we look at the overall value chain of this industry, we sustain approximately 1 million jobs. And we estimate that by the beginning of this current ban, we had lost something like 169,000 of those. And we have had recently the big companies, SAP and Distel, announcing suspension of contract workers. We have also had announcement from Heineken reducing their staff by 7%. And this is happening across the board. I mean, the extent of the investment has been cut as well in the industry. So it's a loss situation for the industry, but also a loss for government. I mean, we calculated the loss in excise tax contribution by the industry to government. That's estimated at 13 billion. And that 13 billion could have easily compensated for the amount of money needed currently to finance the vaccine procurement.
Now, I know that you're hopeful that there will be a review of the ban on the sale of alcohol, but if not, how much longer can the sector survive?
Well, it's a difficult situation. We are hopeful that government will consider the serious economic impact of this, and we understand that there are meetings going on now, and various provinces also that depend very much on tourism as a key economic factor have expressed their views. I think we appreciate very much the views expressed by the Western Cape, which really reflects the extent of this industry in terms of wine production and the tourism effects that our industry contributes there. And the Premier has indicated that we need to lift the ban. We have had that in Gauteng as well, in Victoria and various other areas. And we hope then all of those views and consideration and the clear factual information that indeed hospitals have declined in terms of number of people admitted. And considering all of that, we do not see any reason why the ban shouldn't be lifted immediately.
And what are your thoughts, lastly, on taking court action if, for example, government continues to ban the sale of alcohol and doesn't ease restrictions?
Well, currently in the industry, there are these 2 parties that have gone that route. We have a case from South African breweries. We also have a case from the winemakers, Vinpro, and we respect the direction that they have taken. I think as SALPA, we are of the view that there is still an opportunity for engagement. We have made submissions. We are interacting with various government leaders. We do feel that I think there should be some reasoning coming through in terms of the situation, both in terms of improvement on the impact on the health system, as well as the dire situation of the sector economically. And we are of the firm view that there will be a positive outcome quite soon.
Well, thank you so much for joining us this afternoon and for sharing those sentiments with us. That was Sibani Mngadi.